invited for this purpose, and we have had decided to join forces and to apply for a bid. The Wellcome Trust. The Wellcome Trust has commissioned this study on behalf of the FGHI, and we had proposed a few ideas that are, we are very lucky that they were accepted, and then our research strategy as well was accepted. So as you can see, it's a large team of experienced researchers in country and at global level, and we are very pleased to present the key findings today. The FGHI, the GHI, the way they have been defined by the FGHI and by the Wellcome Trust can be contested, but that's our starting point, and we did not challenge that. Very much the six large GFF, but these were the focus of the study. And of course, we have tried to study them in this environment, this global health system, looking at the links between the GHIs and the rest of the system. The objectives of the study were very much about to try to understand what kind of evidence do we have from the perspective of countries, from low and middle income countries, and trying to analyze the links between the mandates of the GHIs and what they have implemented and how they have done it, very much looking at processes. And finally, to try to, based on this evidence, to try to develop a vision for the future. Okay. That's the program of the day, and I'm sure it's going to be changed over as we go along, depending on the richness of the discussions, but I will be the timekeeper this morning, and being French, we are very famous for not being very good with time, but I will try to make an effort today. The study has been based on the different type of methods, different type of tools. The first one is very much looking at what has been already published in peer-reviewed journals, but as well in the grey literature about the relationship between the GHIs and countries, where they work, where they invest. And to complement that with global consultations and global interviews of key informants, trying to understand as well the perspective from Geneva, from Europe, from North America, trying to understand different perspectives from donors. And as we've seen in the previous slide, that came from Dr. Mercy, a presentation at the launch of the FGHI, we have a variety of actors, UN agencies, donors, bilateral donors, multilateral donors, NGOs, CSOs, international organizations, and so trying to make sense of all these actors and how they interact and how they're interconnected. These key informant interviews at global level were complemented with regional consultations. We have 3 country case studies, Pakistan, Senegal, and South Africa, selected for very good reasons, not only in relation to what the GHIs how the GHI work in these countries, because they work in very different ways, but as well based on the research expertise that we have in the 3 countries. 3 countries is probably not enough. This is why we have decided to organize regional consultations and try to make sense of what exists in Eastern Africa, in South Asia, and in Europe, Latin America, and the Western Pacific. All these data were analyzed using a political economy analysis lens, trying to understand a different type of power, different type of relationship, and how people can influence each other and how they